Welcome to Talkin' Waukesha, the podcast where every conversation springs to life.
I'm Andrew Nofke.
And I'm Anthony Terrell.
And we're your hosts for today's journey into the heart of Waukesha.
Whether you're a local or just passing through, join us as we explore the stories, people, and hidden gems that make Waukesha truly special.
From community events to personal anecdotes, we're here to bring you the pulse of our vibrant town.
So grab your favorite beverage, sit back, and let's dive into another episode of Talkin' Waukesha,
where every conversation springs to life. All right, welcome back to another episode of Talkin' Waukesha. Today we're joined by Anna Diaz and Joe Lichucki. Welcome.
Good morning.
Hi, good morning. Thank you for having us.
Yeah, so they're both part of our crisis response unit, and or crew, you might hear it be called as well. To start, we wanted to help listeners better understand what the crisis response unit or crew is and why it was created. So can you tell us a little bit about yourselves and crew, and a bit why it started?
Well, my name is Anna Diaz, as they introduced us as, and I have been a crisis worker for roughly 10 years, working in the mental health field for a lot longer. I was part of a crisis co-responder unit in Milwaukee County before coming out to Waukesha, and Waukesha County did not have any sort of embedded or co-responder models at all. About a year prior, the county sheriff's department started an embedded model where the clinician from Waukesha County Crisis was actually at the sheriff's department and self-dispatching to calls.
Okay.
However, City of Waukesha has a higher call volume overall, and a lot of the people with mental illness live in the City of Waukesha. So we really just needed some additional response. It takes time for a clinician to come out. So kind of backing up, in the state of Wisconsin, it's required that a crisis worker respond out if at all we're talking about taking away a person's civil rights to get them mental health treatment. Sounds scary. It can be, honestly. But realistically, years prior to that, officers could just do the Chapter 5115, the emergency detention. But that changed in, I think it was 2016. So
in that case, sorry to interrupt, but
Yeah.
is that if they're a danger to themselves or others,
Correct.
that's when they can be detained?
Correct. So with that being said, in the City of Waukesha, if, say, officers out on scene with a person, there is usually a wait time. So officers get the call through dispatch, they respond out to the scene, and then they determine, yep, we need to have a crisis worker come out. Then they call crisis, and then crisis may be on other calls, and then you're looking at another hour before a clinician gets on scene. So the crisis is often over by that point.
Right.
And part of the things that we really, really stress with the county is a mental health crisis deserves a mental health response. Officers are not, they're CIT trained. They go through the crisis intervention training. So they do have some of that, but they're not clinicians. So I think really we need people like me to come out on scene right away. So a previous officer that was in this role really pushed forward, reached out to me, asked me questions about how this model would work. And I guess the rest is history.
Yeah.
Joe, what about you?
Yeah, good morning. I'm Joe Lichucki. I've been with the City of PD since 2009. So I've been on the patrol level. So my day-to-day consists of responding to calls and stuff. And then this position did start 2 years ago, and it really kind of piqued my interest because it wasn't something I'm really familiar with. I mean, mental health wasn't something I had, I guess, a passion for at the time. But the more we experience it here on the job is the more, interested I became in it. So for me, this is a temporary specialist position, so it's a 2-year stint. So I started last year, and this is my second year. I think I will have the opportunity to write for it again and hopefully continue being in this position because I really do enjoy it. And it's really opened your eyes to a lot of what's going on outside of just the criminal law and the criminal aspect of policing. Yeah, it's very, very different.
Yeah, I could imagine so, yeah.
How is crew responding differently to than traditional police responses?
Yeah, the biggest difference is being a police officer, you like to solve crimes and catch the bad guy. In these type of calls, there's no crime and there's really no bad guy. So it's you really have to take that extra few steps, take the extra time, ask a lot more questions. And a lot of the officers just want to get through a call and then on to the next call. Where in this position, we have a little more time to spend to find out what's causing the crisis, try to get them, number one, de-escalate a little bit, and then hopefully try to prevent future crises to happen, or at least lengthen the time between them. Because a lot of these situations we're not just going to solve and they're going to continue.
Right.
But the fewer calls for service with this individual, means we're doing our job.
Is there a little more education that kind of goes on with, if it's a neighbor that's responding saying, my neighbor's having a crisis, can you come out and solve it? And then maybe it's not that big of an issue. It's just a lack of understanding. Is there kind of an education portion that goes with it too?
And that's a huge portion of the calls we get is you see somebody walking on the street talking to themselves. That's unusual. But for us, it's not unusual. And we could probably, if we get a description of what the guy looks like, we probably know who this person is without even arriving on scene. Because, we're so familiar with the people that we talk to on a regular basis and the behaviors that they exhibit. We probably know who they are before we get there. And we have an idea of how to handle that situation once we do arrive. But yeah, educating the caller, letting them know that, hey, number one, this person can be in the public like this. They're not causing a problem. It's unusual. You're probably going to see this behavior again. Feel free to call if you need us to respond. But again, just letting them know that people walking around in our population, they can do that.
Yeah, as long as they're not causing harm to themselves or anyone else.
Correct.
Absolutely. Correct.
Yeah. For all you know, they could just be someone on the phone with a headphone in talking to that looks like they're talking to themselves.
Yes.
We get so many calls of people with their heads down thinking they're sleeping and they're just playing on their phones.
Yeah, I can imagine.
All the time.
So is Crew a partnership between the city of Waukesha and Waukesha County? What services are offered by Crew to support people or residents or the community members who are experiencing crises?
Sure. So I think what's kind of unique about having a co-responder model is that I have access to medical records. I have access to maybe connecting those people to their case manager or to their doctor, therapist. There's a lot of different levels of care, a lot of different services offered, not only by the county, but also other outpatient treatment programs, within the city, as well as just the region. So I can connect those people where officers don't have access to that. They, have to, maybe they can look through call history and see that a case manager was out with them at one point, and they can maybe have a phone number that they can call that person. That information is probably not accurate anymore, and I have access to that. So I can get those people connected. And, I can call, say somebody is on an order and needs to get their monthly injection. I can call the clinic and say, hey, when does this person need their next injection? Can we bring them in? And I can get them their medication in that moment. I can connect them with the pharmacy. I think, the officer on the road may be able to call crisis, but realistically, it's easy to just have me on scene and just do that for them. So. Yeah.
And it's weird, the relationship that we have is there's a lot of information that Anna can't share with me.
Correct.
Even though she's literally sitting right next to me. She'll share the stuff that might be safety related, but anything that's protected by HIPAA and stuff that she is unable to share, she doesn't. And that's just kind of what I expect. And
a team with a natural legal barrier.
Absolutely, yeah.
Correct.
Then it requires a lot of trust then between each of you.
Yeah, absolutely, yeah. A lot of her work is separate than my work. It's just the way it is.
Sure. Yeah. So what community partnerships does Crew utilize to help support the people you interact with?
I think the biggest one is Waukesha Memorial Hospital. We have a memo in place. We have a monthly standing meeting with them that is literally a crisis response meeting. And we go over some of the people that have been utilizing the ER quite frequently and how we can best support that individual, whether that is taking them to another type of program. For example, somebody struggling with alcoholism, are we taking them to a specific facility for substance use versus taking them to the ER, if they're agreeable, obviously. Yes. Or trying to find some way of supporting that person at their home instead of going to the ER frequently. We have a lot of people that want to go to the ER because they're upset with their group home staff. So how do we mediate that situation? I think, like I said, Waukesha Memorial is really our biggest partner. We also have some, partnership with the shelter system. And I know we're not a part of that meeting, but the neighborhood engagement unit is part of that meeting with the homeless outreach. So I connect with NAMI pretty frequently if we meet with somebody in the community that is homeless and may or may not have services. And I'll be like, hey, Sunny from NAMI, are you familiar with this person? They told me I could get in connection with you. They're wanting you to come out. Can you come out today? We just had something not that long ago where the person was homeless. We got them into shelter, but we couldn't sit around and wait to transport because they weren't going to be accepted for, I think, 4 hours. So we connected with Sunny from NAMI, and she said, yep, I'll come out at 2:00, meet them there, and I'll take them to the shelter.
Awesome.
So
Yeah, it was a gentleman whose car broke down. So he was living out of his car, minding his own business, and then unfortunately had to get it towed. And then that relationship, again, spiraled into now what is he going to do? Because he's homeless in our community and he's a little bit older of a gentleman. And the National Alliance of Mental Illness, it's a fantastic program that really assists us in what we're trying to accomplish on a day-to-day basis.
Yeah, it's a great partnership to have, for sure.
I know also the fire department has the mobile integrated health unit. I don't think we're going to cover it, at least on the question, so I wanted to bring this up now. How is that different than the crew? Because I know a lot of stuff kind of overlaps, but it doesn't at the same time.
yeah, so Megan and I work very closely together on a lot of different calls. My role is pretty limited to crisis intervention. So I go on scene, I make a determination, we may have some follow-up, but it's not really, we may connect them with services, but I don't necessarily do a lot of ongoing work.
Right.
I think Megan has a lot more opportunity to do some of that ongoing work, and she's not restricted to, I guess, the statutes when it comes to what crisis is, what therapy is, because she's not, I'm a billing, I bill. So I think there's a bit of a difference there.
Sure.
Also, I have the quote-unquote magic wand to put somebody under a Chapter 5115.
And what would that be?
That would be the emergency detention where we take somebody into custody for being a danger to themselves or others. We don't like to do that. That is not our role. Our role is actually to decrease Chapter 5115s, and I think we've been pretty successful doing that actually with this role because I'm coming out right on scene and I can de-escalate. Where not that officers are trying to escalate a situation, but they're just not equipped to handle things. And some of it is really just connection with services.
And I think naturally people, when they see law enforcement, they kind of escalate a little bit more because they get nervous. Whether they've done something wrong or not, you get nervous around law enforcement.
Exactly. So I think that's the biggest difference is that I have that power and she doesn't. Sure. We definitely have a lot of overlap. She focuses more on the medical side. I focus more on the mental health.
Okay. Makes sense.
And she actually called us out to a scene last week where a lady was doing not very good medically and she wanted us to respond and it fit the criteria to take her into physical custody for a chapter. And she got the medical needs that she needed at the hospital because she was really not doing well physically. So it was kind of a...
Yeah. And in that situation, it was related to mental health.
Sure. Yeah, and that's a way that I had done a video with Megan, so I actually hadn't put the two and two together that, the crew is more mental and that the MIH is more physical. And I think that's a great way to distinct the difference between the two.
But they can both bounce them back
Yeah.
between each other very easily.
It's a Venn diagram where they do overlap.
And we all play well in the sandbox together, which is nice.
Yes.
Yeah.
So looking a little bit more at the training experience and day-to-day realities involved with being part of crew. So what training is required to be an effective member of crew?
I mean, for me, I think it's the willingness to just be associated with a population of mental illness because it can be very troublesome at times. I know as a department, we're trying to get, I think our goal was 75% of all officers trained in CIT training.
So it's crisis intervention training, right?
Correct. And it's very interesting because, the one part I fully remember is you're wearing headphones and then there's somebody talking to you in the headphones as you're trying to have a conversation with an officer. And that's true reality of what some people are experiencing. And unless you physically feel that, you're not exactly sure how to put yourselves in their shoes, which is, I thought it was an kind of eye-opening experience for me. But yeah, I think the main thing is just you're wanting to do this. And I think that goes with a lot of specialty positions. I mean, you have to have some sort of passion to do it. And then therefore, I think you put forth the time and the effort to make it successful.
Yeah, definitely.
Yeah, and it only makes you a more successful officer. Like it doesn't hurt you to have that training, right?
And I think experience too on the job too. I mean, the more years you've been on, the more you've seen, the more experiences you can kind of tie into it. I think a newer officer may have a longer learning curve than somebody who's been on for 5 to 10 years. I think that makes a big difference as well.
Yeah, 100%.
So what sort of cases do you commonly see in Waukesha, and how does crew then assist with those cases?
It varies so much.
Yeah, it does. Yeah. I mean, a neighbor complaint could turn into a mental illness call.
Right. I think a lot of times, as Joe said earlier, we get a lot of calls for just people concerned about others in the community. May look like they're talking to themselves, or they're just kind of loitering. Things like that. I think that's the bulk of like the daily calls. But I mean, we get an example. Somebody is hearing voices, maybe not drug use, and family doesn't know what to do. They don't want to go get treatment, or family is scared to talk to them about it. I think a lot of people are afraid to actually put a label on things, or, because that means it's going to be a long-term treatment plan for that person. So a lot of family don't want to get that answer because they're afraid of that answer. Example, roommate trouble because the person suddenly is having a mental health crisis, no history of mental health issues, possibly substance use related, but we have no way to prove that or know that. And unfortunately, in a lot of those cases, we have to walk away because there's no dangerousness. And yes, the person may be, unwell and are going to continue to have law enforcement contact, and we want to try to prevent that.
Right.
There's a lot of times we just have to walk away.
I mean, we have a lot of, it's come as a suicide in progress, but it's really just somebody self-harming, somebody who just cuts themselves. We have a lot of overdoses that'll come in, and a lot of those are just recreational overdoses. They're not trying to hurt themselves. They just are trying to get high. We do a lot of well-being checks. I mean, that's something we talked about before. And a lot of those could be mental illness related, or sometimes they're not. But we try to put our finger in the pulse of all those calls just to see if there's anything we can do to help. Sure. A lot of times we're unneeded, so we just kind of move on to the next one. But we definitely try to help out where we can.
So does crew typically come in as an additional responder, or are you kind of a first responder where you're brought in first for some situations?
Always both.
I would say both.
Yeah, just because, I mean, Anna is not an officer. I mean, I have to worry about protecting her first.
Right.
So we always have another officer on scene, if not a second one, just to make sure the scene is safe and calm, and then we can release one of those officers and keep one here, and then Anna and I can do our job.
Gotcha. So what are some of the common misconceptions that people have about mental health crisis calls?
I mean, I'll say it from the first one is that we can just scoop people up and take them somewhere, no matter what, right? This person needs help. You need to drive them to the hospital. And it doesn't quite work that way because they have a right to live the way they want to live. I mean, we can certainly try to influence them to do what we believe is correct, but ultimately they have the say unless we have criteria to actually take them in for their own safety or well-being.
Yeah, I think that's probably the biggest misconception. We've had doctors even call and say, this person's not taking their meds, you need to chapter them. And it's like, no, this person is not dangerous. There's no any immediate threat to their safety or somebody else's. They're not into the point where they're so impaired, like their judgment is so impaired that we have to take them in because it is going to result in death. So I think that's probably... we deal with that almost on a daily basis.
So it seems like there's a pretty fine line of when you can chapter someone or not.
It is a very strict, it's a law, so we can't just scoop people up and take them.
I mean, we used to back in the day when I first started, we would just call the charge nurse, tell them that this person took some drugs to kill themselves, and that was enough. We could just take care of it over the phone. It was a pretty simple process. Yeah, but the process had become a lot more complicated over the years just to protect people's rights.
Yeah, sure.
So, of course, without violating any privacy, can you share some success stories of how crew has made an impact in Waukesha?
Yeah, I mean, we've definitely had a few people. We're not going to get rid of all of. I guess a lot of officers think like, okay, well, you have contact with them. We're not going to have contact with them again, and that's not necessarily the case. However, we can definitely drastically reduce calls for service for people if we're if we're playing the long game, like we're not going to be able to do stuff immediately. Sometimes we're able to get somebody into treatment and it sticks. And I mean, we've had a couple people who I think we may hear from them. There's might be a call from service like every 6 months when previously we've had calls every day of the week. And it's just due to relationship building.
Yeah.
So,
and that's a huge change in itself of multiple calls a day to just a once in a while.
And if they get to know, like there's a couple people in the community that we've gotten to know, and they're like, if they'll call, they'll specifically want us to come out, things like that. I would say that that's a success because they don't want just random people coming out to them.
Yeah. Well, it's kind of that, they take the medicine, they start feeling better, and then they think they can stop taking the medicine because they're feeling better again, and then they kind of decline, and then we have to have
You're feeling better
with
because
them.
you're taking the
Yes,
medicine.
and a lot of people don't quite understand because a lot of times there are side effects, whether it's your blood pressure goes up or your heart rate goes up, or you don't feel as good physically, but mentally you're better. So there's that pluses and minuses, and a lot of times they choose a certain path, and here we are getting calls for service again.
Sure. Well, hopefully most of those calls are more cordial, I suppose. Once you realize like, hey, you started taking this, try taking it again. And
I will say this though, I mean, when we show up, I mean, there is some familiarity of us coming, and their behavior gets better immediately because they do know us and know that we're not going to do something crazy to them. So I think our consistency with people does definitely help quite a bit.
Yeah, definitely. So one of the more misunderstood parts of the crisis response involves homelessness and how communities respond to those people in need. So there's a brochure that's available online on the Crew's webpage on the city website that mentions an effort to, quote, decriminalize mental health-related homelessness. So what resources and support channels does Crew help connect our homeless population with?
Like I mentioned earlier, Sunny with NAMI is like my go-to. We can connect with her, see if they're on the list for coordinated entry, which means like getting eventually into an apartment, getting on the homelessness shelter list, because a lot of times there aren't openings. Obviously connecting with the shelters, Salvation Army, and like we don't have the same like entry process as like Milwaukee County does, so we can get connected to them directly for beds. So them and Century House / Juno House are like our primarily connections when it comes to shelter. Unfortunately, a lot of the people who are homeless in the community are getting into like sometimes criminal activity. If it's mental health related, there is some things that we can do. So, for example, if there's a person who has substance use plus their mental health issues, and they're committing crime because of their mental health issues, if there's an arrest done, that person can no longer seek voluntary treatment. So even if they were voluntary, we would have to do a Chapter 5115 on that individual. Obviously, we have to have criteria to still do that.
Right.
But if we can say this person's judgment is impaired, they engaged in this dangerous activity, they are going to jail, but definitely need mental health treatment first, we can get them to our mental health facility and get them the treatment. So I think that's our ultimate goal. It doesn't always work out that way.
Right.
If we're working, we're usually able to kind of steer the person away from jail and getting them treatment, but that's not always going to be the case.
And then from kind of the officer standpoint, is our officers are well aware that this person in public is being disorderly. It fits the statute. They could arrest them, but they know it's probably not due to them understanding that they're causing a disturbance. It's just that's their being at that moment. So that's where they reach out to us and see if there's something we can do, opposed to just arresting them, giving them a ticket, and then moving them on, because that doesn't help anybody.
No.
So yeah, in the realm of like it's not a crime to be homeless. It's not a crime to have, need mental help in some way. So I guess how is Crew and, the county, the city, how are we better addressing homelessness, I guess, in the community too? Because it's a tricky conversation. I know a lot of residents and listeners are, they bring up concerns about it, and it's not wrong to be homeless. It's an unfortunate situation.
It is, yeah. And because the city of Waukesha does offer so many services when it comes to providing food. The Hope Center is wonderful because they're able to supply clothing and say shelter during the day, is that we get new homelessness people every day. I go through a list of all the calls for service, and I would say at least twice a week, there's names that we've never run before that are now sleeping on the sidewalk, that have an address outside our city, that are now here.
Yeah.
A lot of times we don't know why they're here. They could be brought by family, they could have walked here, they could take the bus, but now we have another person because of all the services that the city does offer, which is positive.
Yeah.
But it does attract more people that don't have housing or stable. Yeah,
that's always something I've tried to explain to people too, is like Waukesha is phenomenal in trying to offer services to people who are unhoused. If that's the situation, you're going to attract more people because there's solutions here.
And the biggest issue with the homelessness is that we don't have any city property that they can live on because we just don't allow habitation in parks, which most of the people are living in parks. And then any private property, they have to have permission to have. And most of the time, they don't have that either.
Right.
So there's just no good space for them to be.
Yeah.
And there are people who legitimately want to remain homeless. So all of the resources that we can provide, they don't want them. So and that is their right to be homeless. We all know that renting is expensive. The cost of living has gone up so much that there is some limitations. Person might be working. Actually, a lot of the people in our community who are homeless do have jobs. It's just a matter of being able to afford an apartment.
Right.
And you can't afford an apartment.
It's hard to create that
wage.
savings. And,
Correct. And especially when you're in that situation. So I definitely, it's multifaceted, as we know.
It's such a complex issue. That. And like you said, there's plenty of people who wish to remain unhoused and homeless because it's just what they're used to, what they're, and there's plenty of people who are also homeless where they don't cause any issues.
There's a lot of them.
Yeah. And I know that the endless cycle that we see is that somebody will get housing, and the homeless community is a community. So then they will then allow their other homeless friends to stay with them. And then what that does is that causes a problem within the apartment, and then eventually they lose their housing, and then that person is kind of crossed off the list for future housing because they had it and unfortunately made some bad choices and lost
tricky.
it. Yep.
And you would love to bring your friends over,
Right,
to stay with you.
Yeah.
I have a roof over my head, come over, warm up, whatever.
Exactly. But it
doesn't always work out for the positive.
No.
Yeah.
Fortunately not.
So is there something that you have personally witnessed that might help our community kind of approach homelessness with more compassion and empathy too? Maybe some insight too?
Just recognizing that homeless people are people. So, when we approach them, we come to them as like, hey, you can't be here. Is there anywhere else you can go? What kind of resources can we provide you? Who can we connect you with? Just being, able to have that open conversation about things with people, I think is so very important. And even if it is just connecting them with Sunny from NAMI, there are tons of resources here. If not, Milwaukee has resources. Other counties have, we have better resources than I think a lot of other counties do, just because we're still like somewhat urban.
Yeah.
So people have access to those. But really it's just being open to listen to people.
I know a lot of, if there's a group of people that appear homeless, that are congregating underneath an awning or something in a city park or on a bench, and, some people call, I want them removed. I'm like, we really can't remove them.
Yeah.
I wouldn't remove your family if somebody else called about you. So, we got to treat them just like we would unless they're causing a disturbance of some sort. Correct. Then if there's anything we can enforce, we certainly will. But a lot of times it's just for the look. People don't like the look. And that's unfortunately not a whole lot we can control.
Yeah, and that's, I think, most of the kind of the negativity we kind of see is it's the well, it doesn't look great that we have homeless in our community. It's not reflecting our community. It's in a negative way, at least. It's we have the resources to support these people.
We have a great community.
We have a phenomenal
Yeah.
because if there was nothing for them here, then they would, in theory, you would find somewhere else to go to get resources.
If people didn't care, they wouldn't be here. But we have a lot of people that care.
Yeah, definitely.
Yeah, I think encouraging people to volunteer if they're really concerned about the issues, volunteer, get involved with the community. I think a lot of people want other people to handle issues, but really it's a community effort.
Yeah.
So
I believe NAMI does have volunteer opportunities.
They
The
do.
food pantry has plenty of food
Hope
opportunities.
Center, all
Hope
of them,
Center,
yeah, they all have plenty of volunteer opportunities. And I mean, if there's enough volunteers, more programs can be created. And
every dollar that you don't have to spend on staff, you can put into resources.
Yep.
So beyond every crisis call, there are real people, as we kind of discussed a little bit, both that are asking for help and the crew members responding. So how do you avoid burnout in such an emotionally intense situations?
I have been doing this for a very long time. I have been somebody who has been through burnout. When I was a case manager about 15 years ago, I got to the point where I just didn't have the support of my supervisors. Not that they weren't trying to be supportive. It was just there is limited support in community mental health. So having gone through it and needing to leave, I think I left the field for 6 months. I think it wasn't even that long. I think I probably could have just used a long vacation and I would have been fine. But I left the field for about 6 months while I was in grad school, got back into it for my internship and have kind of made my way back to community mental health fairly quickly, actually. But really it comes down to leaving work at work. It's not always easy. The case last week where there was the medically compromised person, I really struggled not taking that home with me, just because it was such a significant situation. But at the end of the day, if I constantly come home and I'm thinking about work and am, needing to, am just kind of ruminating on it, it will never end well. So I really have developed that ability to, once I'm off the clock, I really just try to disconnect.
And what do you have some sort of mantra or methodology that helps you do that?
I don't think I do. I get asked that question a lot, and I can never say the word compartmentalizing. That's how you say it, right?
Yep, pretty good. Yeah, you got it. You nailed it.
Wow, I got it the first time. So I think that's kind of how I've done it over the years. That's the only way I can think of that I've been able to do that. But before, it was when I did go through burnout, I couldn't. And maybe that's what it took, was going through burnout and kind of trying to develop that skill and taking that break.
Because then you know where your limit is.
Right. Yeah. I mean, I was working probably 15 hours a day, no overtime, that kind of thing.
That'll do it too.
Yeah. It was driving all over the community, getting pulled over because I was, having to go from one side of the county to the other. And this was Milwaukee County, but multiple times a day. So I would probably be putting a couple 100 miles on my car, sometimes a day, depending on what all my clients had scheduled. So it was a lot, and definitely needed a break. And crisis work there's definitely overlap with case management, but crisis work is a little bit easier you are on scene. Like I said, you deal with the issue at hand, you problem solve, and yes, we may follow up, but it's done. And that's probably why I like doing what I do.
Yeah. And for me, I guess I just have a short memory. Like my friends will ask, what's the most exciting thing you've done? And to be honest, I couldn't write a book about my stuff because I just don't remember all the stuff that happened. I know there's a lot of it too, and it's probably really interesting, but it just doesn't benefit me to, I guess, remember it because it wasn't a big part of my future. It helped me in the past, sure, and it got me to be a better cop, but there's no reason to relive some of the bad, terrible things that we unfortunately have to come across.
Yeah, but then also as a police officer, besides just the mental health stuff, you're also just dealing with everything else in between too. So you've got it's a lot to handle.
Yep, absolutely. And the other thing, like just from a personal standpoint, and I mean, I try to eat right, I try to exercise, I try to do all those little things, that sleep right, all the stuff that you
Take care of
focus on.
yourself.
Yeah, after work, and I think that really makes a big difference because it does add up after a while if you don't do that.
Yes, it does.
So then, what motivates you to continue this work?
I love doing what I do. So crisis work has always been a passion. I like being able to be there. It's almost an honor to be there for somebody's most difficult moment because they're having to put their trust in somebody that they don't know to try to make things better. So I think being able to be there for that person in that moment and then making sure that they're connected with services and have the right support, whether it's they go into the hospital and are inpatient for a few days, or we're just connecting them to a therapist and they're seeing, they're going into, more of an intensive therapy program for a couple weeks just to kind of get back to baseline. And we're able to follow up and see that they're doing well. And even like that's not always the case. We know that things are not always going to end well for the people that we work with. But again, the fact that they are trusting me to kind of support them in the moment, I think is what helps me keep going.
Yeah, definitely.
I know a lot of officers may say this, but it's the thrill of the unknown. Every day is different. You never know what today's going to bring or what tomorrow's going to bring. And we enjoy the days where we're not terribly busy, but then we also enjoy the days that we're overwhelmingly busy. It just kind of keeps us going.
So one final question, and I think I've posed this to a former member of crew as well as kind of if no money was an object and anything could kind of happen. How would you like to see crew grow within our community and within the county?
I would love to see 7 days a week, even if it's not 24/7 coverage.
24/7 coverage.
Okay, 24/7 coverage.
Let's be honest, yeah.
Because I really see the benefit of having a clinician responding out at the same time as officers. The embedded models, they're listening to the radio and then they're responding out. Sometimes, officers or deputies are calling them directly like, hey, wasn't a mental health call, but there's definitely a mental health component. Can you come out? And there's still a little bit of a lag. I'm going out immediately in the moment. There's a lot to say about having a clinician on scene at the same time than having to wait for the clinician.
Right.
I would love to see more coverage. Our second shift clinician is going to be starting the 6th. I am actually transitioning out of this position. Technically, I'm not full-time anymore. And my replacement starts the 6th as well. But I have been given the opportunity to still fill in on crew. So
very nice.
I've been covering most of this month and we'll continue to do so as clinicians have vacation or are out sick, things like that. So I will be continuing to cover and, hopefully in the next few years we'll have more coverage, like even beyond,
And that's great too, that like you don't feel like you're forced to, not take vacation because there's just not as a breadth of coverage as there could be.
Yep.
Yeah, and previously there was no coverage for the embedded roles. So the clinicians, when they went on vacation, the officers were without a clinician. And that's not just at this program, it's at our others as well. And they've given me the opportunity to continue to cover. So very excited for that.
Yeah. And I know the officers really appreciate Anna being on scene so quick because a lot of times, if there is an hour, that officer has to fill that time for an hour. And a person in crisis, that can either go very good or it can go very not so good. It all depends on that officer's ability to, just engage in conversation with somebody who's severely mentally ill, which is challenging at times.
Yeah.
And like, for example, yesterday, like if they would have had to go to different calls and wait for a clinician, when we knew that there was nothing that we can do for those individuals, it still helped. Like if they would have had to call crisis and have crisis come out and wait, that person may have escalated and it would have become an actual crisis. We were just
or it could have turned criminal too,
Right,
depending
exactly.
on the person's behavior. We never know.
Yeah, and so having me to just be there and be like, "Yep, there's nothing we can do here," that gets the officers to clear the scene faster as well, versus having to wait. Because some of them, we probably would have waited for crisis to come out, at least to evaluate and see if there was anything that crisis could assist with.
Right.
And that adds another possibly hour to the call where we can clear it in 15 minutes.
Right.
Well, do you have anything else you'd wish to share for any of the listeners? Anything about Crew, anything, words of hope and encouragement about this program?
No, I would say I would still encourage people to contact the police department if they feel they need to. We're definitely not going to discourage them from calling about the person talking to himself on the street, because you never know when that might be the time that we can actually do something for them. So I would always continue just to encourage contacting us, and we can certainly help where we can.
Yeah. And I would encourage families to reach out to Crisis. Reach out to 988, reach out to the Waukesha County Crisis. You could reach out to Crew directly if you live in the city of Waukesha, because even if we can't do anything in the moment, we document all of the phone calls that we receive. So, if a person is, maybe starting to have a first break of psychosis. So one of the things that has been proven is that the quicker that you can get an intervention for somebody in psychosis, the faster that they will have recovery and potentially have a better recovery, like prognosis. The longer you wait, the likelihood that the following break is actually going to change their baseline. And so please call. Please reach out to us. Even if we can't do anything in the moment, we can document it and we can provide resources. And I know that sounds, people are like, well, what is a resource going to do if I can't? It's still helpful to know what your options are.
Sure.
There's different interventions that can be done. We didn't talk about 3-party petitions, but if somebody is having a pattern of dangerousness, it may or may not rise to the level of being able to have Crew come out and take somebody into protective custody, but the families notice the pattern and has it documented. They can petition the courts to get that person mental health treatment.
Gotcha.
It's not a fast process by any means, but that is always an option. There's so many different types of treatment out nowadays. A lot of people are resistant to seeing a therapist in person, but telehealth is widely available to all. 988 is a great resource for people that they can just call when they're experiencing suicidal ideations, even if they don't have a plan or intent. Even if it's not suicidal ideations, we can get them connected with a therapist. Almost all of the clinicians are licensed clinicians. So it's a great resource. So please do call us. We want to come out. We want to help you.
And if someone is noticing someone who's out in our community and they're not a harm to themselves or someone else, is it best that they call non-emergency, or is it best that they call?
Yes.
Yes.
Non-emergency, please.
Yes.
unless the person is doing something like walking in traffic. I mean, that's dangerous enough for us to come lights and sirens, because you never know if that's an intentional act or if they don't even know they're in traffic. So I guess it's just the person's discretion.
Yeah,
if they feel we have to come quick, we'll come quick.
You feel they're safe and you're safe in the situation, non-emergency. If
Correct.
anyone feels in danger in any way.
Absolutely.
Yeah.
Correct.
Well, wonderful. Well, thank you both so much for
Thank
joining
you very
us.
much.
Yeah, thank you for having us.
Yeah, I appreciate it.
And that's a wrap for another episode of Talkin' Waukesha. We hope you enjoyed diving into the heart of our city with us.
If you have a story to share or just want to say hello, reach out to us on social media at City of Waukesha on Facebook. We love hearing from our listeners.
Don't forget to subscribe, rate, and leave a review if you enjoyed the conversation. It really helps us spread the word.
As always, thanks for tuning in to Talkin' Waukesha, where every conversation springs to life.